The content herein is for informational purposes only, not intended as medical advice, diagnosis or treatment, and is not to be substituted for direct advice from your doctor.
Today's LymphCast program is proudly sponsored by VitaSupport MD, the makers of Vein Formula 1000 and Lymphatic Formula 1000. These MPFF-based nutraceuticals are backed by science and recommended by doctors specializing in venous and lymphatic disorders. Visit VitaSupportMD.com to learn more.
Well, greetings and welcome to our LymphCast show, episode 51 tonight. We're really glad that you are with us. A reminder, every show is on every podcast platform under the sun, wherever you go, Spotify, Apple Podcasts, TuneIn, Stitcher, Amazon, you name it, we're there. Every show is also on YouTube. Just go to YouTube, fire up the show, and every episode is there in living color. We also want to direct you to our website. Everything is there as well, lymphcastnetwork.com. And let's go ahead and meet our panel tonight, the gentleman who started this show from a simple seed of an idea to now 51st episode. He's also the founder and owner of VitaSupport MD. They make Vein Formula 1000 and Lymphatic Formula 1000. From New Jersey, physician surgeon, Dr. John A. Chubak. Hello, Dr. Chubak. How are you today?
Hi, Paul. I'm doing great. Thanks very much. I'm excited about this evening's program. We have our minimized group with us today because other hosts and co-hosts have some obligations that they couldn't break. But I'm still very, very excited to have today's guest with us.
All right. I'll turn it right back to you because you actually know this person personally. We'll probably get into that as well. Take it away. What's she all about? What's her name?
Yes, I do. Thank you, Paul. Tonight's guest is Pam Molinari, and Pam happens to be a patient of mine. And it's a big part of the reason that she's on the show tonight, because I think that her background and her personal background, her professional background, her medical background are all so interesting that I wanted to have this opportunity for her to share her story with our listening audience, because I think it's fascinating and I think there's a lot to learn from it and a lot of really positive things to take away from it. Pam is a registered nurse. She trained at a very, very fine institution out in the Midwest at Barnes, as I recall, and worked there. And she's had a long career in nursing. She only recently, very, very recently, has retired actively from nursing. And her husband is actually a chiropractor, a health professional, and the two of them had for, I believe, about a dozen years on public access television some years ago, their own health-related TV program, which was quite successful and fantastic in many ways. So she's hosted her own program, and we'll get into her various and sundry personal hobbies and loves and passions and things that she's involved in, which I think our guests will find not only entertaining, but extremely motivating and inspirational. And I think that having been taking care of patients for a long time, Pam really stands out in being super optimistic, super positive. She's a great patient. She's a great person. So I should begin by saying that Pam came to me through the reference of a colleague of mine who's now retired. And he's also a vein specialist. He's now retired. And when Pam was having some troubles, he was kind enough to recommend that she see me. And she could tell us more about her experience in being seen by doctors and so forth and evaluated. But I saw Pam and I immediately gave her the diagnosis of lymphedema, a combination, as we know from our program, of chronic venous insufficiency, lymphedema, and lipedema, or lipedema, if you prefer. And we had a long discussion about that. I had a discussion with her and her husband about that at one consultation, and we looked at all the options for her. But one of the main options, of course, was treatment of her underlying venous disease, which we have now more or less completed, I believe. And so Pam can speak to that. And that's how we came to know each other. And we've had a very excellent, I think, professional relationship. And I think she's been very pleased. And it's been my great privilege to take care of her. So without further ado, it's my pleasure to introduce Pam Molinari. Welcome, Pam.
Thank you so much for having me on your show. Thank you also for the great treatment that you have given me, because I was at the point where I was giving up hope. Even though I'm a health professional and I've dealt with people with lymphedema, chronic venous ulcers and stuff in my career from 1975, I wanted to not get to the point where I was going to develop a venous ulcer or lose my legs. I started out as a kid with extra wide feet, I had thick legs and arms, and, I was not diagnosed as a child. My parents were more upset about me being heavy than they were anything else. I was a precocious puberty. So at 9, I was fully developed. And, all of a sudden I put on weight, which they were very concerned about, but they never took me to a medical doctor to see if there was some other underlying cause. When I became pregnant, I gained 100 pounds. I was like 130 pounds when I first got pregnant, and then I ballooned over 200 with my son, and you couldn't even see my toes. I mean, my legs swelled up like you wouldn't believe. I had preeclampsia. With my daughter's pregnancy, I only gained 24 pounds, and she ended up being a 10-pound baby, but I still had the persistent swelling. I was able to work as a nurse. I did med-surg, neuromedicine, neurosurgery. I was on my feet all the time. I always wore a supportive hose and stuff, but I still, by the end of the day, my legs were screaming in pain. I started noticing I was developing varicose veins, I guess in my 30s. And then I went to a vein doctor here locally, and all he did was sclerotherapy of that one particular vein, and I would get it done annually before the summer. And that was the only, that was extended, the only treatment I ever received for varicose veins. The Dopplers were negative. My legs continued to swell. They sent me to a cardiologist thinking I had congestive heart failure. That ended up being negative. Health-wise, I'm great. Low cholesterol, blood pressure is low, pulse rates in the 50s and 60s. I'm very active. In fact, I have a certificate from the YMCA. I was supposed to give classes to heavy people. Being a nurse, they were worried about somebody having a heart attack, but, they never get off the edge. And then I became a professional dancer in my 40s. And even at my heaviest, I got up to 380 pounds. So I said, it's enough. I got to do something about the weight. So I went through a lap band, which ended up eroding through my stomach. And then they had to do a bypass. So then I'm full of abdominal adhesions, had to have a gallbladder operation, and everybody refused to treat me. A lot of doctors, when I would go to their office, they would take a look at my BMI, and they refused to do surgery because they were worried about their 100% surgical success rate. I had 3 gallbladder attacks. I knew desperately I had to get it taken out. So I called a friend who was, a big girl like me, and I said, who did your surgery? And she had referred me to this young doctor who just got out of Johns Hopkins, and he was willing to try. He did it laparoscopically. I was home in 3 hours. I couldn't believe it, right? So this is what doctors do to bariatric patients. They refuse to do surgery on them. They don't really diagnose them, or they don't do a workup. They just sort of dismiss you. With COVID, I was sitting 10 to 12 hours a day, which of course made the situation with my legs even worse. I was also working weekends, so I'm sitting. It got to the point where even walking was painful. It was restricting my activities. So I went back to the guy that used to do the sclerotherapy, and he said, well, go to my son, who is a doctor in Columbia Presbyterian, and he's doing this new procedure where they do the sclerotherapy, but they use some kind of sticky substance so you don't have to keep doing it all the time. I said, okay, fine. So I'll go for a consult. The guy, all I did was show him my leg. Yeah, I mean, I wasn't in a hospital gown or anything. He didn't even touch me. And he's like, no. Well, maybe your veins are being pressed by your arteries and stuff. So he wanted to do a cardiac cath on me. I was like, no, I'm not doing that. Then I tried to get into the Morristown Vein Center. 4 months to get an appointment, and that was only with a PA. So I called my friend Dave, who referred me to Dr. Chuback. I got an appointment in 3 days. My husband came, we had a lot of questions. He was very thorough. I never got such a great exam before. I mean, they're taking measurements, they're taking pictures, of every single angle. And he's looking at me and he goes, you got a combination of 3 different things. Did anybody ever tell you that? I'm like, no. He goes, and the other thing that really got me was, it's not your fault. That really got to me, because a lot of people think that, bariatric people are lazy. They're not mobile. They're not eating right. I go to a nutritionist. I was doing everything I'm supposed to do, and it wasn't working. Anyway, so it's going to be a 3-phase process to address all my issues. So we decided to address the varicose veins first, so which we just completed. So, you can only do one at a time. So it's like 16 weeks of treatment and then follow-up ultrasound. So it's a commitment of time. I also went to a massage therapist that was certified in lymphatic massage. She was great. And she ended up being just down the street from my house. But again, it's a commitment. You have to go. She can only do one limb at a time. You have to be wrapped from toes to crotch. And the compression stockings are almost like a cast. It's very rigid. It can be uncomfortable and itchy, but you have to do that or you're not going to get the results. So I did for 4 weeks, and I got a noticeable improvement in the lymphedema just by doing that. And then we started the vein procedures here in March. Now, I think a lot of people are fearful of needles. I don't have that fear, but a lot of people do. And I think that's why they procrastinate on don't go through this, because they're so worried about pain. But it really wasn't painful. I mean, my tattoo was more painful than that, and I did that in an hour and a half. So, but I noticed so many good results with this. I mean, the loss in diameter of my calf, my thighs, my ankles. I don't have the corkscrew. I don't know what you call it, where your ankles like very thin and then your leg balloons out. That's gone down.
Cuffing, we call it.
Yeah, I don't have that pain anymore. The heaviness, you're feeling like you're walking like concrete. I don't have that anymore. So that I'm eternally thankful. The next stage will be going to Dr. Shapiro in Delaware, for the lymphedema problem. So, if you want to have me come back for an update on how that went, I'd be more than glad to tell you about that. Do you have any questions for me?
Yeah.
No?
Go ahead, Paul. Do you have any questions?
I have a few. Yeah, let me start with this one just for you, Dr. Chuback. We've heard the term varicose veins mentioned a couple times already in the show. Breaking it down in simple terms for the layman, the non-medical professional, what are varicose veins and why are they such an issue? Why are they so serious?
Well, varicose veins are dilated, enlarged veins that are under abnormal pressure because, generally speaking, the valves within the veins have failed and they're no longer working properly. We have a series of one-way valves, like check valves, one-way check valves within the veins of the lower extremity, in the deep system and in the superficial system, and they should keep blood going only up toward the heart. And I like to show patients that they should open and close, open and close. And in a process of inflammation, one of two things can happen, generally speaking. Those valves can either be completely deteriorated and then they're absent, and then you have a vein which is empty with no valves, and then gravity can simply pull blood down toward the foot and allow the foot and ankle area to swell under pressure, and as fluid collects in the soft tissue and fatty tissue, you get swelling. The other thing that can happen to the valve under inflammation, rather than opening and closing like a nice check valve, it basically flops back and forth like a set of saloon doors, so that it's not functioning as a one-way valve at all. And then again, blood by gravity is pulled down into the lower part of the leg, causing distension of the veins, pain, swelling, night cramps, and over time that can lead to chronic inflammation, which can lead to discoloration of the leg, scarring of the leg, infection of the skin, blood clot formation, and even open ulceration, wound formation, what we call a venous leg ulcer. And so those are the various stages of venous insufficiency, what we call venous insufficiency. Now, just like any other disease, sometimes you have just the one problem, but people can have numerous problems at once. There's a very common grouping of diseases that, let's say, a primary care internal medicine doctor may see would be high blood pressure, high blood glucose, and high cholesterol. Those are three very common diseases that people get together. In Pam's case, and in many patients' cases, you can have this venous insufficiency that causes varicose veins, in addition to other things like lymphedema. Whenever we have swelling of the leg secondary to venous insufficiency, which we've talked about on our show quite a bit, we call that phlebolymphedema. That swelling from the vein problem is a form of lymphedema. The lymphatic system has been overwhelmed, can't keep up with all the excess fluid. So by definition, when you have a swollen limb from vein disease, it's phlebolymphedema. And then you may have congenitally lipedema, which Pam has had since she's a youngster. She started with early lipedema even before ever getting her menstrual cycle. And then with her menstrual cycle, she saw an obvious change, which is quite common. If Dr. Eicher were here, she would echo that, and she could explain that for us in more detail. But we've talked about that a lot on the show. Something called lymphedema precox, which is a very, very early form of lymphedema, which young girls especially can get. And so she had probably early lymphedema and then lipedema, and that lipedema worsened after she had her first period. And then all of these things worsened after her first pregnancy, which probably also promoted her vein problem, because when the uterus enlarges as the baby's growing inside, the uterus puts pressure on the pelvic veins, and that can tip many people over into a varicose vein situation, a chronic venous insufficiency situation. So for someone who has expertise in these areas like myself and many others out there, to see this sort of triplet of problems together is quite common. Unfortunately, we have so many physicians, primary care physicians and so forth, who are still not aware of any of these three diseases, or those who are not even willing to recognize them as diseases. A lot of people think, physicians included, that varicose veins are just a cosmetic problem. There's nothing really to do for them. It's not covered by insurance. All kinds of misinformation that goes on out there. All you need to do is wear compression stockings or elevate your legs, and there's really nothing to do. And people tell them you should never have them treated because you're going to run out of veins. There's a lot of really, you might need heart surgery one day, and if they get rid of that vein, what are you going to do? Well, as a cardiac surgeon, I can tell you we don't use varicose veins to repair somebody's heart.
Vein Formula 1000 and Lymphatic Formula 1000 from Vita Support MD are backed by science and sold in doctors' offices. If you're a physician who may be interested in prescribing or selling these excellent nutraceuticals, please call 862-246-7877 to speak to a representative today.
So there's, unfortunately, even within the medical community amongst physicians, there's still a lot of ignorance in these areas. So venous insufficiency is often dismissed as not a real disease. And certainly lymphedema is misunderstood. And as Pam said herself, lots of times doctors will say, well, you're just taking too much salt in your diet, avoid things like Chinese food, avoid chips, avoid table salt, or maybe you have congestive heart failure, maybe you have liver failure, maybe you have kidney failure, and they do a bunch of blood work and some other tests to make sure there's no heart failure, liver failure, and kidney failure. And when all of those things check out okay, they're kind of at a loss. They say, I'm not really sure what's wrong with you. Avoid the table salt, avoid the chips, avoid the Chinese food, and maybe elevate your legs. So it's another area where there's very little knowledge. Then when you get to the world of lipedema, there's almost no knowledge outside of, people who we bring to our show. After you're on this show for a while, you think everybody in the world knows about this. But outside of our show, within the medical community, they really do not, and they just think that people are fat, that they're obese. And generally speaking, that's not the case. And that's why I told Pam, as my good friend Catherine Seo, who was recently a guest on our show, said, it's not your fault. I mean, this is a disease. And Dr. Eicher will tell you this is a disease. This is something that people are congenitally prone to. And many times people can be very, very tiny in the middle. They don't have a big belly or huge overhanging abdomen. They can be very tiny in the middle, their torso and their midsection. And many people, their arms are spared. They'll have absolutely normal looking arms. But from the buttocks and hips and thighs down, this is where lipedema and that sort of pear shape that we talk about becomes most obvious. But they just say you need to go on a diet, you need to lose weight, you need to eat less, you need to move more, you need to exercise. And so Pam was in that special situation where she had 3 diseases, all of which are easily missed by primary care doctors and even specialists. Vascular surgeons many vascular surgeons don't know what to do with venous disease. And many health professionals don't understand lymphedema and lipedema. So she was in that terrible situation of having 3 diseases at once, none of which anybody was really willing to pay any attention to, make a proper diagnosis, or at least, as I've said on this show so many times, at least admit, I'm not sure what's going on here, but I'm going to help you find somebody who is aware of what's going on here. And in my practice, I do that all the time. I don't make believe I'm a neurosurgeon. I don't make believe I'm an immunologist. I don't make believe I'm a rheumatologist. I don't make believe I'm a lot of things. So if a patient comes to me with a skin problem or a joint problem or a neurological problem, I say, hey, we need to get you in the hands of a really great dermatologist, orthopedist, rheumatologist, neurologist, neurosurgeon, orthopedic surgeon. I don't know why that's so hard for so many physicians and other health professionals, nurse practitioners, physician's assistants. Maybe it's because we have grown up to believe that we're supposed to know everything, and that if we're really a good doctor or a good nurse or a good nurse practitioner, we should know it all. And by admitting to the patient, I'm not sure what's going on here, maybe they feel that that's putting them in a bad position of looking ignorant or looking unprofessional, or maybe even exposing them to some kind of medical legal, action because I can't make the diagnosis. So instead I'll say, there's nothing really wrong with you. So it remains a mystery why so much of that goes on. But again, for my colleagues listening, if you see a patient and you don't know what's wrong with them, it's okay to say, I really care about you. I'm worried about you. I want to see you get well. I want to see you get better. But I personally don't know exactly what's wrong with you. Let's get some other folks involved. Let's get some other physicians involved. Let's look for a specialist. That's a big part of what we're supposed to be doing, is evaluating patients. And if you know what it is, say it. This is what you've got. And then treat it if that's your purview. But if you don't, there's no reason to be ashamed. Let's help these people who have obvious problems. I mean, Pam's problem is not a subtle problem when you see her, when you meet her, when you examine her. I mean, it's clear that something is going on there. So all you have to say is, I'm not really sure, Pam, what's going on here, but let's see who might be able to help us. So I know that's a long-winded answer to your question about varicose veins, Paul, but it kind of just led me down that rabbit hole of all those other issues that are associated. Pam, do you want to respond to anything that I said and any experiences that you had that might resemble those remarks?
Well, as a nurse, I saw, people at different levels of different problems with lymphedema or, venous ulcers and things like that. I never heard of lymphedema, the disease, Pat, and stuff. I wish I had known, because I had all these symptoms, like the cat going across my lap. I'm like, ow, ow, ow. People taking my blood pressure. Ow, ow, ow. It makes you more sensitive to pressure. I was a little sick of going to the airport, and you have to do that X-ray thing, and they're always patting me down because they think I'm packing drugs in my legs and stuff because they're so disproportionate to the rest of my body. I'm a professional belly dancer on the side, and I do salsa and flamenco. So I'm very fit, and I have a lot of muscle under all this. And I'm very flexible. I can touch my toes, do splits, and all that other stuff. So I don't fit the norm of a typical fat person. You know what I'm saying?
Well, again, let me just jump in right there. That's one of actually the telltale signs that something could be going on and that the patient may have lipedema, because we know that, again, this quote unquote fat disease, where the patients can be very tender to the touch, easy bruisability, but they also tend to be hyperflexible. So it's kind of shocking for people to see somebody of Pam's size and with her shape and body habitus that she could do a split or easily touch her toes. I mean, it's shocking for people, but that for our healthcare practitioners out there, that's one of the questions that you want to ask. And then there are associated things like Ehlers-Danlos syndrome and other connective disorders that have been related. But you want to ask, like, hey, how is your flexibility? Are you hyper flexible? Can you touch your toes? Many of these people are dancers, were gymnasts. Dr. Eicher talks about that a lot, looking at some of the young gymnasts who are still in, tremendous physical condition, but she looks at their body habitus and their flexibility, and she wonders, I wonder if this young woman has early stage lipedema, and she's interested in following them into later life. So that's a very important thing to talk about. But one thing that Pam talked about just there, being a belly dancer and doing flamenco and salsa. Pam, one of the things that I've been so impressed with you about is your self-esteem, your self-confidence, and the fact that you really, in my mind, and the patients that I've seen, stand out in terms of your unwillingness to be ashamed of who you are and how you look. Can you share with us what you think kind of your secret is as to why you're so great that way? It
was a long evolution. As a young girl and stuff, I come from a long line of some really beautiful women. I have a cousin that was a Miss America contest. So I was always thought of as a disappointment because of my looks. And I didn't accept that even as a kid. I was like, I'm smart. I'm funny. I have all these talents and stuff like that. So I didn't want it to be judged just because of what I look like. So it never stopped me from doing anything. I was an athlete when it wasn't popular for a girl to be that in 1970s. I lifted weights. I was on the boys cross country team. I did a lot of things that weren't traditional, but I just did them anyway. To get over self-consciousness, being a performer, when you're on stage, you have to forget about what you look like and stuff and just be in the moment of the dance because you're trying to tell a story or express a feeling. So it's very freeing in that respect. And I found that people didn't judge me. In fact, a lot of people came up, oh, you're an inspiration. I'm like, oh, I'm not disabled. I'm just fat, But I didn't want it to stop somebody else from trying either. So it's been a great career. I mean, I shouldn't have had any career at all, being my size and what I look like. But I have a following and I have my groupies and, I was supposed to perform in Seville, Spain, flamenco on a stage, right? This is like, yeah, me, right? I don't know where it comes from. I guess, I just accept who I am. This is the temple of my soul. And my soul is gorgeous.
Yes, it is. I agree with that. And and you're gorgeous, not just your soul. But you've done some amazing things. Tell us about stand-up comedy. Tell us about motorcycle riding. Tell us about some of these other amazing things.
Yeah, I mean, my kids are like, oh my God, what is mom doing now? But I want to enjoy my life, and I don't want to spend it watching television. So I'm always like trying to learn something new, I took cooking classes. I make my own cheese. I make my own wine. I have a garden. I decided to take up motorcycle riding, and that wasn't easy. But I mean, my bike was 1,500 pounds, and I had to be able to handle it. So, and I did. So I was like the mascot for a Harley group, and I was a part of the Riding Divas. And we did a lot of charity runs and stuff, including I did one for a patient of mine, a young girl that was a quadriplegic. So I raised money for her and stuff. So yeah, it was great for 12 years. And then, I gave it up when I was starting to get weaker as I was aging. And then I lost 8 friends to traffic accidents. So I decided, now it's time for another hobby. I was also a competitive volleyball player for 20 years from the age of 30 to 50. So I got my sports in.
How about your stand-up comedy?
Well, I always wanted to do it. So I have a friend that put on a show and she was looking for different talents. I said, well, instead of, dancing, I says, I'd like to try stand-up comedy. She says, sure, try it out. So she gave me 15 minutes for a set. So I did it about being a shopaholic, and it was all COVID's fault, And then I did a second one about getting my first tattoo with my daughter, so, but I posted it on TikTok, and I actually got somebody from Carolyn's and the comedy club and wants to see more of my material. So I might have a new career now that I'm retired.
You said, what material? I don't have any more material. I have to write some material. So that's great.
Yeah.
And what about, you talked about charitable things. I know that you've mentioned to me several times while we were doing your procedures about parades and things. And
yeah, I do the Coney Island Mermaid Parade, the Asbury Park Mermaid Parade. I'm supposed to be in the Pride Parade in 2 weeks in New York City. I did Dance Parade in New York. I've done that for many years. I get invited all over the country to perform. I've been in Washington State, California, Maryland, Connecticut, Pennsylvania, New York. I'm going to be performing next week in South Jersey for the veterans. So we're doing a benefit for the veterans. So that keeps me busy. And I also drum. So I'm part of a group, and I also African dance. So
you got the right guy. Paul is an expert drummer. You can see his drums right
I did djembe in the djembe. Yeah. Yeah.
Absolutely.
I was in Woodstock 2 years ago. I performed for Woodstock for their 50th anniversary.
Really?
Yeah.
What'd you do? Like
musician.
No, I danced for them under this huge bonfire that they were dedicating to the founder that died. The newspapers were there and stuff. And so I'm under the stars, under a full moon, with my lighted wings, and I was also drumming. And those guys don't sleep. I mean, you're drumming all night. But it was a really cool experience.
Did you sit in with the Rolling Stones or AC/DC or anybody like that?
I used to hang out with them.
Oh, you really?
Back in the day.
I'm telling you, she's the most interesting woman in the world.
The most exciting patient you've ever had, John.
No, I wouldn't say that.
Great stories.
I just tell them I'm an onion. I got layers.
She doesn't always hang out with musicians, but when she does, it's AC/DC and the
Oh yeah. Black Sabbath and AC/DC. When I was in the biker group, they played for us and stuff. I got to meet the guys.
That's amazing. You know what? I loved what you said tonight, Pam, and I think we have to always remember this one, Paul. And we're gonna in future shows give credit where credit is due. That it was Pam Molinari who said tonight, I love this so much. I'm not disabled. I'm just fat.
Yeah.
Yeah. And it's okay, right? To be fat, and your fat disease is not your fault. But again, you're not denying that, okay, I have a fat disease. It's not my fault, but I'm still fat, right? But that doesn't make me disabled. And that doesn't mean I can't ride a motorcycle. And that doesn't mean I'm not funny. And that doesn't mean I'm not a great dancer. And that doesn't mean I'm not beautiful. And that doesn't mean I can't participate in the parade or I can't walk a long distance. I mean, you walk tremendous distances in these parades, correct?
Yeah, you're not kidding. 10 miles.
She has tremendous endurance.
Yeah, and you're dancing too. And you got heavy. Some of my costumes weigh like 20 pounds. Between the jewelry and and it's jeweled. Yeah.
She recently performed at a college. How did the young people respond?
They love it.
I know.
You love it,
Of course.
because a lot of girls at this age are very self-conscious and stuff like that, and they see somebody like me, old and fat, and they're doing it, and they're clapping, Don't be afraid, just do it,
So great.
Yeah.
Well, more questions from you, Paul. I'm sorry, I got in your way. I want to hear your questions. Paul is a great interviewer. He's got his own shows and everything. He's an amazing radio talent, and I'm glad it's just the two of us tonight. I want to give Paul some more of the floor because he always comes up with great questions. Go ahead, buddy.
Go ahead.
I appreciate that. I was thinking, John, as I was sitting here and listening to Pam and the comedy act, and I'm sure patients come to you sometimes, Dr. Trebeck, maybe all of the time, the first time. They might be in some pain, discomfort, apprehensive. Oh boy, what's next? You ever thought about turning your waiting room into a mini nightclub and hiring Pam to entertain your patients before they see you?
It's not a bad idea. Yeah. Many years ago, I had a wonderful secretary. She was much more than a secretary. She's passed on now. Unfortunately, Diane, we'll call her Diane O. And she was like a mother to me, quite frankly. When I was coming into surgery, she had already been working with surgeons for 30 plus years. And sometimes I get called to the operating room, and she'd have a waiting room full of patients waiting to see me. And I'd say, Diane, I'm going to be, a couple of hours late. You got to tell them that they either have to reschedule or if they want to wait, I'll be there. But she said, don't worry, Doc, I'll go out there and I'll dance for them and I'll entertain them. And she was terrific. And she was also, as I'm using Pam's terminology now, so nobody's offended. She was a big girl too, but she would, all joking aside, go out there and just talk to the people and chat and keep them company and make them laugh and pass the time. And so those are great gifts when people can do that.
Oh, very much so.
Yeah.
A question for Pam now. Based on the early part of your story tonight during the show, sounds like you had this going on very early in life and nobody knew. Your parents didn't know, the medical professionals didn't know, you didn't even get to a professional for a long time. Looking back now on your life and with your training and your work as an RN, so you have a lot more expertise than the average person off the street. When do you think this really came to the forefront? Looking back, you didn't know it then, but looking back, about what age would you, if you knew then what you know now, you would say, okay, I'm age whatever, and I have this?
I went my 40s. That's when I started taking control of my health. I had a huge lipoma on the back of my neck, 7 inches long, but I thought it was just a dowager's hump. So I let it go, and it got to the point where I couldn't sleep. And they told me, this thing is wrapped around your spinal cord. That was like a big wake-up call to me. I said, I got to do something. So I survived that surgery, no problem. And then I had the lap band, which perforated through my stomach. Almost died from that too. Then they had to do the bypass. But I lost 150 pounds. And then I was left with all this hanging skin.
At VitaSupport MD, we believe in creating the best bioflavonoid-based supplements to support your vitality. Bioflavonoids are found in abundance in nature and support excellent health and wellness. The demands and stresses being put on our bodies in these challenging times are unlike any we have seen before. Support your body with the flavonoids it needs to fight inflammation and oxidation. Unlike other products in the marketplace, VitaSupport MD dietary supplements use micronized flavonoids for optimal absorption and effectiveness. Micronization is an advanced process which creates an ultra-fine powder easily absorbed by the body. At VitaSupport MD, we are passionate about making your good health our life's work.
And then I had to have a total abdominal hysterectomy. So I got the panelectomy done and the total abdominal hysterectomy done at the same time. But I had complications and adhesions and stuff. So it was a 10-year battle trying to get my health back. So my 50s were great, and now I'm in my 60s, and now I have the time to take care of myself and get serious about it. I don't have any excuses anymore, Mm-hmm. The other thing I'd like to address, though, is the insurance aspect of this. A lot of people are concerned, this is going to cost a fortune and stuff like that. I found by switching from primary insurance to Medicare, everything's covered. But that took 2 months to make the transition. And still, they had problems with insurance submission. But now it's starting to get paid. But if anybody else is going through this and they're 65, switch to Medicare if you're going to start treatment. They cover more than the primary insurance does.
Well, don't they have to switch to Medicare at age 65?
No, you get Medicare A, which is secondary, and that covers your hospitalizations, but you have primary. But the thing is, with the primary insurance, the deductibles have gotten so outrageously steep, right? So if you do a cost analysis, it ends up being cheaper going on Medicare and getting a B and a G and a D policy supplemental than it is having primary insurance. Okay. So that was a learning thing for me, which I wasn't aware. Also, the cost of compression stockings. It's very difficult to get a good fit if you're not standard, okay? It took a long time for me to find the right product that fit my legs well, that was easy to apply and didn't itch me like to death. I spent a lot of money on dressing supplies that went from my toes to my crotch, which are now just sitting there I'm not using anymore. And then it was like $250 worth of dressing supplies. Then I got this Velcro new thing that's out that, the doctors were like, oh, this is really great. Well, when you have Velcro and you're walking, your legs stick together and you almost fall down. I was like, this isn't going to work either. And believe it or not, I found the best thing were like these thigh-high things that go all the way up. And they're comfortable. I can sleep with them at night. And I've gotten such a good post-vein procedure response with them. That I'm so glad that I took the chance to try all these different products to find the one that worked for me.
Okay. So, just quickly though, back to your childhood. I thought you said you were fairly large then. Do you think you had some?
I really wasn't large. I was maturing fast.
Okay.
I was 5'5" and at 9 years old with fully developed female anatomy and stuff, and had my period, which stopped my growth. The males in my family are 6'10", 6'11", 7'2". They thought I was going to be the 6-foot girl because I have a Norwegian Scandinavian background. Okay. But I think that because I had early puberty, it stopped my growth.
Okay. Dr. Chuback,
my daughter's 5'10". My daughter's 5'10".
All right.
But she's got this too. And she started treatment. Okay. And she's 39 now. She just started treatment.
Okay. Dr. Chuback, quick question for you. Pam mentioned she'd gone to various physicians and maybe surgeons, I think she said, and they didn't want to operate on her, and they basically sent her on her way. And she made reference to, they didn't want to ruin their perfect 100% score. I don't know if they told you that or you inferred that.
They did.
They did tell you that. Is that, I know what your answer is going to be, Dr. Trubeck. That's why I'm asking you, because we've talked about this before. Thoughts on that? Is that proper? Is that legal? Can it be done? Or should they just say, hey, I have a patient here, I need to do something?
Well, statistically, heavier people do have more complications. Yes, I understand that, but I'm not everybody.
Right.
Well, yeah, it's obviously very neglectful. And I think that it's unethical if you know what's wrong with the patient and you know how to fix it, and it's your job to fix it, then I think it's discrimination to deny that patient access to care, especially if you don't do something to at least assist that patient in getting in the hands of somebody who will help them. In other words, I don't think it's appropriate to say I have a 100% success rate, and therefore I don't want to ruin my success rate and take a risk. But surgeons can say to people that I feel that you're at too high a risk. Okay, I don't want to put you, the patient, in harm's way. You shouldn't be doing it to protect your own perfect record. And again, any surgeon worth his or her salt knows that any surgeon who has a perfect record in anything is a surgeon who is not
he's cherry picking,
not trying very hard, not operating very much, and not taking care of really sick people. I trained in some of the best places in the world, at Sloan Kettering, at Yale New Haven Hospital, at the University of Rochester Strong Memorial, where they wrote the textbook of surgery and so on and so forth. And some of the finest surgeons in those institutions, of course, they have complications, they have problems, and they have. If there weren't, they wouldn't be great surgeons. Great surgeons have to know how to deal with complications, obstacles, problems, etc. So the first thing is, it's absurd for any surgeon to claim that he or she has a perfect record in anything. If you do, you lack tremendous experience, and I certainly don't want you operating on me, because what if there is a problem? You obviously don't know how to handle it because you've never seen any problems, right? So it's the reason they put pilots in simulators and they kill both engines, or don't let the landing gear come down, or have a fire in engine one. If you don't know how to manage complications, then you're not a great surgeon. You're not going to impress anybody who knows what they're talking about. Okay, so that's number one. Even if the surgeon felt that, Pam, I think that I know what's wrong with you and I know what you need, but I think that you're too high a risk. I'm afraid that you might have a heart attack, that you might have a reaction to anesthesia, that you might have a blood clot to travel to your lung. There's lots of things that can go wrong. But why don't we see if we can get you in the hands of a high-risk specialist, for example? Right there in the field of obstetrics, I got a picture of my dear old dad there behind me. He was an OBGYN for 40 years, right? He took care of a lot of very, very sick people because he worked in the inner city for his career, okay? But there are, let's say, obstetricians who don't take high-risk patients. Pam was mentioning before that she had preeclampsia. There are people with preeclampsia, eclampsia, et cetera, et cetera. Obese patients who are, brittle diabetics. Okay, then you say, listen, I don't handle high-risk cases, but let me get you to Dr. So-and-so, that's all he or she does for a living. You don't say you never get to have a baby because I don't do it, or you don't get to have your veins fixed because I'm afraid that you might have a problem in my hands. You have to say, I think that your problem can be dealt with. We just have to find you the right doctor. Otherwise, it's a form of patient abandonment, quite frankly. It's discrimination. It's neglect. It's absurd.
No, it happens a lot.
Happens a lot.
Happens a lot.
I have to tell
a
you,
lot of times when I go to places, I don't tell them I'm a health professional, first of all, because they do treat you different. I keep it secret.
Well, that's that. you just brought up something fascinating that I was about to segue into. The other thing is Pam had kind of a double whammy. She's heavy and she's a nurse. So then that means she has knowledge, she has insight. And she was the kind of nurse, like a nurse. Like she trained, at a world-class institution. That's in St. Louis, correct?
Yeah.
In St. Louis, she was a real, med surge floor nurse, neurosurgery nurse, took care of sick people. Like she knows medicine kind of a nurse. Not maybe a nurse, with all due respect to anybody out there, who's just, let's say, working for the insurance company and doing paperwork or something. I mean, she's a nurse's nurse. Like my mother was a nurse, okay? So that's the last thing somebody wants. Like, oh, here's a patient who might have problems, might have complications, and she's going to have great insight into this. I'm not going to be able to, quote unquote, pull the wool over her eyes if there's an issue, right? So that's like double, stay away from me, you're trouble. With a capital T, right? So the other place I've seen that, believe it or not, over the years is with lawyers. I've taken care of a lot of lawyers who were turned down at major New York City academic centers, being told there was nothing that could be done for them. And then they heard about me, came to me, and I treated them. And in the beginning, when I was much, much younger, when this first happened to me, and I would see this young attorney come in, I'm going through the chart, I'm going through the history, and I'm racking my brain. Why didn't they take care of her? This is so straightforward. This is such a slam dunk. It's a chip shot. It's just a garden variety case. Why did they not operate? And then I realized, I bet it's because she's an attorney and they're afraid they're going to get sued.
Yep.
And I pointed this out to them and they thought it was fascinating. And I have to tell you, what Pam just said is probably good advice for nurses, attorneys, other, healthcare professionals. I think, believe it or not, you're probably, in many cases, decreasing your chances of getting the care that you deserve, because people get intimidated. People are frightened. And I can understand that. We live in a world, it's a litigious world, and, people bring lots of frivolous suits and so forth. And I think that some physicians have become gun shy and they say, why should I put myself in this situation? Let them go someplace else. If you're going to do that as a physician, I think you have to be honest with the patient and tell them that that's why you're declining to care for them. And if you do that, you have to be open about it and you have to help them to find someone who isn't intimidated and isn't afraid. But that's another subject. But we do know that heavy patients, obese patients, do get neglected and dismissed. I've seen it many times, and Pam's seen it through her whole adult life.
Yep.
And that's wrong.
You, Dr. Chubak, she's a nurse, and you said, come right in. Let's see what I can do for you.
I think he came in because I was recommended by his friend. I didn't say I was a nurse, I don't believe.
But at some point he found out. He didn't say, get out of here.
Yeah. Well, I wanted to be honest with him. I didn't want to start it with, to me, Dr. P,
I don't.
This, is sort of sacred. I mean, you have to trust your, person that's going to treat you, that they're doing what's right by you. And you in turn are responsible for your body, and you have to do what they say will give you the best outcome. Otherwise, what's the point?
I take care of many, many nurses. I have an enormous number of nurses in my practice, attorneys, physicians. I don't turn anybody, fat people, skinny people, old people, people with, HIV, with hepatitis C, with infectious disease. I was raised by a mother and father whose lives were committed to healthcare. My mother was a nurse in Jersey City and met my father there. My father was a physician in the inner city for 40 years, dealt with a lot of infectious disease in an area where there was a lot of underserved community, poverty, et cetera. Those things don't even cross my mind. Your job as a healthcare provider and as a physician, as a surgeon, you've taken an oath, the Hippocratic Oath, to take care of sick people. That's your job. If you take those things into consideration, I think you really should reconsider your profession. And I think you shouldn't really call yourself a professional.
Well, you can also add to your business cards, you treat comedians and drummers too.
And belly dancers. That's the best part.
And motorcycle riders, or former ones.
Exactly.
You know what I'm thrilled about, though? I was telling him, but it was sort of a joke, but it's not. As belly dancers, we wear some, really sexy kind of things. And I've always been constrained because there's always a slit on the left leg, and that's like my bad leg, right? And now I can show it off. Thanks, Doctor.
She had a huge varicose vein going down the front of the left thigh and across the outside of the left thigh, which is now gone, thank goodness. So, well, I think, I knew it was going to be a great discussion, a lot of fun, a lot of laughs, but a lot of serious subject matter that we covered. The time always goes too fast. I really enjoyed having Pam on the program. Would love to have her back again in the future, especially as she said, she's planning to go on with some more treatments and surgeries for the lymphedema. And I would love to have her back at the end of that journey and get her thoughts and have her share her experience. So with that, Paul, I think we're gonna sign off for this evening. Why don't you take us out?
All right. We appreciate everybody listening, watching tonight. LymphCast Show, episode 51. Head to our website, lymphcastnetwork.com. Every show is in podcast land. Every show is on YouTube. And if you have a question for Dr. Chubak or anybody on the panel, you can send it by email to hello@lymphcastnetwork.com. Dr. Chubak, before I thank you for everything tonight, you want to take a moment to thank Pam?
Yeah, I want to thank Pam Molinari very much for being with us. Thank you. She's a great human being, an inspiration to us all. She's a great patient. And you know what? She promised me she would be. She said, I'm a great patient. I'm going to, I'm not going to give you any trouble. I'm not going to, give you any problems. I think she felt like she had to convince me out of the gate because she has been turned down and denied by so many doctors over the years. But it was a great privilege, and it is a great privilege to continue to take care of her. We'll continue to watch her and care for her in the future. And then I just want to give it back over to Pam with any final thoughts or wisdom or anything that you'd like to say to our listening audience.
Please make an appointment. Get a consultation. See what help is out there. Go to a specialist. Don't go to your primary care physician, which probably doesn't know. Research everything that's out there. There is help out there. Good luck.
Thank you, Pam. We always say that there's always help and there's always hope. And I'm going to reiterate one thing she said. If you go and you see doctors and you know you have a problem and they tell you there's nothing wrong with you, or they tell you that they can't help you, keep looking for another doctor. Keep looking, because they're out there. People, I'm certainly not the only one, far from it. There are a lot of great physicians in this country and around the world for our international listeners. I mean, some of the doctors from other parts of the world are pioneers and leaders in these areas. So if you know you have one of these problems, or two or three of these problems in combination, keep searching. You owe it to yourself. You deserve the care. And there is hope and there's help out there. Don't give up.
All right. Thank you again, Pam. And we want to thank the gentleman who started this whole show. He's also the founder and owner of Vita Support MD. They make Vein Formula 1000, Lymphatic Formula 1000 from New Jersey. Physician surgeon, Dr. John A. Chubak. Thank you, Dr. Chubak, for everything. Thank you, Paul. It's been a pleasure as always. I'll be visiting your office next week just to check out the mini nightclub you're going to establish in the waiting room. So Pam will be our star entertainer.
On headlining.
That's right.
That's great.
And we thank everybody for tuning in again to LymphCast. It's been episode 51. We'll see you next time for the LymphCast show. Have a great night.
Bye.
Night, everybody.